Hello, everybody. This is Dr. Kashif Abdullah. I am right now doing another live stream chat on basically. Uh, excuse me. Sorry. I'm doing a live stream chat on coronavirus or anything else, or you can ask me anything. So let's see. Let's see. Let's see. And if anyone is on this widgety, let's see. Let's see. I am live streaming right now. My channel. So this works. Okay, let's see. Okay, so if anyone out there has any questions, feel free to ask me. So let's see, and I'll go back and forth. Let's see. Let's change streams views here. Okay, there we go. Oh, there's a question. Doctor of Medicine? Yes, I am a doctor of medicine. James LeBron? Yes, I'm a doctor of medicine. So I practice out of San Jose, and I have my own clinic, and I'm doing the stay-at-home order, and so because of that, I usually have been doing a lot of telemedicine chats or what have you. So in the meantime, I'm doing this as well. So I'll say hello there. Yes, I am a doctor of medicine in California, in San Jose, California. There we go. So yeah, let's see. So if you have any questions, Mr. LeBron, you can of course ask me. So let's see. So the first thing I want to go over with is today's number. So we have unfortunately 3 million total cases. The U.S. today has surpassed 1 million total cases. So the 1/3 of the total confirmed cases in the world are coming from the U.S. alone, which is very bad. The total deaths in the world have been now 215,000, way too many. And I would like to just pause for a second here and just say that the coronavirus is not the same as the flu. I've been hearing a lot of this about this. It's a little bit of nonsense. The flu is not as dangerous as this. We don't have immunity as a population like we do have against flu for most regard. This is something new. This is not something to be played around with. So let's see. I'm going back and forth the questions. So let's see. If we look, we have and just to let everybody know out there, I do this from usually 12:30 to 1, but today I was a little bit late. I had to do something, so I'm usually I'm doing it from 1 to 1:30. So I do it every day, weekdays from 12:30 to 1. Today is a little bit of an exception. And actually, let me tell people. That's just my own channel. I am a physician. I'm just trying to recruit people, I guess. Physician, you can, and I am doing a live stream on my channel. Oops, there we go. You can ask me anything. Okay, there we go. Let's see. So, thank you for going. How would a patient go about getting their complete electronic medical record or health record from your personal record, and what's your view on the corona spread and as the major reasons for outbreaks? All right, so your complete medical record is a little bit hard to get. I would say that in regards to getting the outbreak, so let's see. So you would get you can. So Mr. LeBron, you can get a partial You can't get the complete because physicians and hospitals don't do that. So you can get a partial record of your of the EMR. Okay, and in regards to view on the corona spread, so my view on the corona spread is that it is, like I said, it's let me show you this view screen again. It is a pandemic that has been going on, and the US is the worst hit. And I would say that if you actually look at the US in general, it's beginning to slowly trend down. If you take the large trend line, it's beginning to trend down in the US. But you have to remember, look at this. There's over 20,000 cases a day. That's 20,000 people testing positive for a virus. And that's can be a deadly one depending on your demographic or how old you are, what have you, or your pre-existing conditions. So that's a lot of people. And if you look at Spain, the next one, they come down to they're trending down. They will likely control the coronavirus by the end of May if you follow this trend line. And they're right only 2,800, and the US, if you look, is in like the 22,000. So that's, I would say, that my view is that the US especially is not taking this seriously, and I think the major reason for the outbreak is people not taking social distancing seriously and going out and about and spreading this disease unknowingly. And I think we need in the US more testing, when we need, frankly, contact tracing. And outside of a vaccine, which is going to take almost maybe now a year, maybe less than a year, we need to do contact tracing. That happens when we have tests. I frankly don't know why the US is not having enough tests. You know, I would say you can get those kind of tests anywhere, like from South Korea if need be. So let's see. And if we look, it looks like we may have dropped off with viewers, what have you, but let me see if I can tell people. Let's see, YouTube live. All right, let me just switch back here. So, let's see. But my view is that it's been getting worse and worse and worse. Not worse and worse, it's getting better slowly, but we're not taking it seriously enough, frankly. And let's see. Let's see.
Hey, I just read an unbelievable article in the Epoch Times. Take a look. It's an investigation into the mysterious...
Yes. Okay, there we go. Okay, so it's happened. Let's see. Let's see, I'm a physician doing a live stream, US based physician doing a live stream right now. I'm actually just telling people that I'm doing this stream right my channel. You can ask anything, even non-coronavirus topics. I'm not sure if my So let's say if anyone is... Oh, there's people back. Oh, hello. Sorry, I'm just trying to recruit people here. Okay, so let me change the view again. And go here. There we go. So, if we look at the US, and okay, so what I've been doing as a physician is trying to figure out this coronavirus, I'm looking at the trends of where the various countries are at. And you'll notice that the various countries are, the US here is beginning to trend down, but it's very It's still a lot. Spain is beginning to really cut down on their coronavirus, and then Italy is doing a very good job as well. I would anticipate both Spain and Italy have cut down their coronavirus by I would say by the end of May they should be down to zero, like New Zealand. New Zealand actually did it, just like South Korea and Austria, and I believe Australia too, and I think I forgot Switzerland. I think is there as well. Let me just quickly double check. No, okay. So, and let's see. You can see that France is also beginning to trend down. United Kingdom is beginning to plateau, sort of like the U.S., but the number of cases are nothing like the U.S. U.S. has 20,000. The U.K. only has 5,000. So, Germany has basically they're also going to completely knock this out. I would anticipate by May they will have controlled this virus. Turkey is beginning to also do it. Russia has been just out of control. Russia, I do not know. I just think the virus there is much greater than 93,000, and you'll notice it's an exponential growth. There has been no anything happening in Russia. I don't know what's happening there, but Iran is this is a little bit fakeish to me. This is too regular. So I think this is a little bit manipulated, frankly. China is completely manipulated. This is just nonsense, frankly. 83,000 and not, yeah, I doubt it. Brazil, unfortunately, is going through like an exponential growth. See any questions? No. Remember, you can ask me anything. It just doesn't have to be a coronavirus. I'm checking back and forth. Canada has begun to plateau, although the number of Canadians that daily get it are very not as much like nothing like the U.S. But they're trying hard also to flatten the curve, but they have not. Belgium, they're also flattening the curve, and you'll notice the daily number of cases in the Netherlands is also falling. And if you look at India, they're just exponential growth. They're just really high. Switzerland is almost completely gone. They will effectively flatten the curve. Let's see. Let's look at Ireland. They're also doing really, really well. Sweden, that is a nice, very nice sharp drop. So they're really they're hunkering down a lot. And the total numbers they had was nothing compared to the rest of the world. If you look at 700, 800 max, and then now they're gone down to like 286. That's very impressive. Israel is also dropping it down completely. Mexico is recently it's trending down. That's good, but we have to continue to see more data. Austria basically has essentially almost eliminated it, and Singapore trending down, not too bad. Pakistan trending down, but I think there's more. I think they're really like India, and they just do not enough testing to show. Chile, Japan has done nicely too, but they're a little spike recently. But is there any questions? Let's see. And let's see. I'm just trying to see if I can. Let's see. I am doing a ask anything regarding coronavirus. Oh, that didn't work out as well as I hoped it would, but oh well. Okay, so anyway, let me continue. Sorry, I'm just trying to tell people that I'm answering any kind of questions, and I can also answer questions about anything else: high blood pressure, cholesterol, diabetes, and I'm going back and forth to see if there's any. Oh, there's a new question. Let's see. Where are you getting your data from? Is it from Worldometer? Well, I'm not getting my data from Worldometer. What I'm getting it from is actually the Johns Hopkins website. So how I found this website, and this is actually, if you actually look at a lot of the data that people are getting, depending on, let's see, if I show you this one, this is coming from, I'm not sure where this one is coming from. but I'll show you how you get it. So this is from John Hopkins. So in the U.S., so Tayyaba Hamza, I am getting this from. So I live here in the U.S. and I'm getting this data from John Hopkins. Just to let you know, full disclosure, I also went to John Hopkins, so I'm partial to them. And John Hopkins basically gets all their data from I believe a variety of sources, but more so they're usually, I think, WHO sources, but they're a very trusted source. And the US, and this is also the data that most publications in the US will be quoting from. So it's very simple to find. You just go to Google and you put in coronavirus, right? And you put in John Hopkins, right? And it'll be right there. So you just click that and out it pops. So, and it has a lot of other things too. It can show the US and critical trends within the wider world. So if I show you, let me show you the critical trends here. So if we go here, you can see how does mortality differ across different nations. And you'll notice that Belgium and France, the mortality is much higher than, say, in the US, China, or Germany. And I would attribute that more, and also Italy is also high, but I would attribute this high number because there are more elderly people, I would say, or the population, the age of the population is higher in, say, Belgium, France, and Italy than it is in the US or China or Germany. Although China, I take it with a lot of grain of salt. I believe they manipulate their data heavily to show that they are one of the leading nations. So if you look at mortality, you can see the U.S. is much less than, say, Italy. But I would say the age of both U.S. and Canada are similar. And if you look, U.S. Canada have basically the same case fatality. That's largely, I believe, due to the age of the population. Even though the confirmed and deaths are less, but the Canadians are a much smaller country than the U.S. in population generally. Let's see. And then there's other data you can also see. If you go here again. But, which states, how is the outbreak growing, cumulative cases, and they're just measuring where is it going the highest. And of course, that's the U.S. The U.S. is outranking everyone in the number of cases. And frankly, I believe the reason is because the U.S. is not taking this seriously. They're, frankly, if you ask me, half-assing everything, and they just want to take shortcuts. I would say California is perhaps the best, although maybe I'm biased too because I live in California, but I would say compared to the rest of the country, California is doing the best job in controlling this virus. And actually, I can show data with that. I can show, if you go to the U.S. map and you look in general of all the data, you'll notice the biggest hotspots are in the Northeast, and also the South is beginning to get light up. As opposed to California, it's one of the most populous parts of California, Los Angeles, and here they only have 20,000 cases and 944 deaths. Whereas if you go to Manhattan, oops, that was not what I wanted. And I don't want to go to wherever but if you go to the U.S., if I go to New York, we'll just look at Queens. So if you go to Queens itself, there is 48,000 confirmed cases, whereas in Queens' population is not that high. Like you can get more data actually this way. Queens' population is only 2 million, whereas Los Angeles County is 10 million. So it's much more dangerous in the Queens and New York area than, say, in California. Let's see, what else can I show you? Let's see, I wanted to, you know what, let me just tell other people here. Let me see if this works. Just let people know. but I've been trying to, just let people know. So I've been trying to do this every day, weekdays, from 12:30 to 1 o'clock. Today I was a little bit late. I had to do something else, but I just want to let people know that I am I'm a physician here in California. I do this from 12:30 to 1 o'clock every weekday during the coronavirus outbreak, and especially the stay-at-home orders. And you can ask me anything you want. Um, I've been doing this for about a month and a half or so, and if you have any questions about anything else, you don't have to do this coronavirus, can be anything else. I'm here to answer those questions, and I figured I'll just keep doing this until I get a larger population size, get the word out. Everyone's different when they come in and they come out. I try to be as consistent as I can. Do this for half an hour, and you can ask me anything. If you want, you can ask me blood pressure questions, or you can ask me, oh, my uncle's like this, or my aunt's like that, or my mom is this, my dad's that. You can ask me those questions. I'm happy to give you my take on whatever issue you may be having. And so it's like talking to a doctor right then in front of you. Of course, if you want, you can Google me. I'm not too hard to find. I'm basically on the internet anywhere. Let's see what else. Let's see. I'm not sure if anyone else is. Oh, there's lots of people calling and what have you. And if need be, I can also discuss other topics. So let me show you this. Let me pull up just before we close for the day, maybe. Let's see, where did it go? Oh, it's right here. I just have to open. I did a radio show a while back in the Bay Area, and I created these topics, and like I did one for low back pain. Oops, I don't want that. Well, an open file. Sorry, where is it? Here it is. There we go. That should work. That's better. So let me switch. Let me switch gears here. There we go. Let me show you this. So I did something like this, low back pain, and I discussed during that half hour while I was doing the radio show, I would talk about what is low back pain, how do we test for it, how do we treat it, what are the signs and symptoms, stuff like that. So a lot of the times for low back pain is trying to control the pain and restoring the range of motion is the most important thing, and again, improving your muscular strength in the back. The more you can improve the muscle, even if you have slip disc or other joint disease, the better, more muscles that you have around the spine, the better you can actually control for pain. And physical activity and exercise is important to help lower back pain. You can, of course, there is a whole bunch of medicines that can be used, but over the counters like Tylenol or acetaminophen, or ibuprofen or naproxen, or you can use like topical lidocaine can be used, or muscle relaxants, which I don't like giving out at all. Opioids can be also given, or steroids. Even antidepressants and anticonvulsants can be used for that. So I can discuss those kind of things too, and I was thinking of doing that in depth. Let's see. Oops. Sorry. That's actually also my patients are calling me. Oops, that was weird. But if you have any kind of questions, I'm here to answer those questions. And like I said, I do this from 12 to, there I am. Let's see. 1 second, here we go. Let me just switch screens. So I'm here basically from 12:30 to 1 o'clock, and I appreciate any kind of questions. It's not, I will say this much, it's not easy doing these live streams at the very beginning, because basically I'm essentially, right now it gets lonely when there's just two people watching, and I enjoy the two people. Please, if you have any more questions, feel free to ask those questions. But I'm just trying to, let's see, someone is asking a question. Let's see, I was diagnosed with TB meningitis recently. Okay, After 2 months, I have pain in my lumbar while touching. Are they both related? I would say yes, they are related both. So, meningitis is in the inflammation um, of your membranes in your brain. It's basically what it. Itis is always inflammation, or something getting inflamed. Okay, so that sounds pretty severe if you had TB, meningitis, and the best thing I would say for you, I have pain on my lumbar while touching. I'm trying to figure out what you're meaning by lumbar while touching. If that means if you have pain while touching your back, um, that would be related. It's going to take some time for the immune system to go down. I would say in those, first thing, you should always speak to your primary care provider. And then also, I would say in regards to speaking to your primary, is you can discuss things about taking medicines to help relieve the inflammation. So I don't know what your medical history is, so it's difficult to say take this medicine. I would say this is why all doctors say talk to your primary. But in medicines in general that are used to treat inflammation, are like things like ibuprofen or naproxen, or in America the trade name is ibuprofen, is Advil or Aleve. Those can be used for inflammation, but I don't know if that would be good for you. You need to speak to your primary about that. Steroids can also be used for reduction of inflammation, but I'm not sure again if corticosteroids are needed in your case. Someone would have to, in order to adequately treat this, really know your medical history. So um, I would say yes, they are related. They're both inflammations, and if you have an inflamed meningitis, that can lead to also inflamed, because the cerebrospinal fluid is connected. So that may be a possible. It may be related, but it may not be also. I don't know if you've recently had trauma. So there's a whole bunch of things. I would have to literally, so your primary doctor has to speak to you and ask you detailed questions. When did this start? So there's something that, just to let you know, in medicine, how we do it. How we do medicine is this. Usually, most doctors have something called a SOAP note. So a SOAP note basically means subjective, objective, assessment, and plan. So subjective is the stuff you tell us, okay, doctor. And when we do the subjective part of the note, what we do is we gather data of onset, location, duration, characteristics, attributing factors, radiating if there's any radiation, and temporal things. A way of memorizing it is we call it old cart. So anyway, we get this information from you, and that's whatever you tell us. Objective, part of the SOAP note. So first we write down patient is 84. Well, we'll make up like 21-year-old male who comes in for back pain. Started past medical history significant for tuberculosis, meningitis, and then the history of patient came in 2 weeks, was exposed to about 2 months ago to TB, and the last week has recently experienced back pain. Pain started here and there. So that tells us we're basically painting a story for ourselves and for other doctors. Then the objective part is when we do the physical exam. That's what objective is. Subjective, objective. We do the physical exam, and in a back pain kind of thing, we will do. We'll just do a range of. We'll examine the back to see if there's any kind of inflammation. Then we'll do a range of motion. We'll do palpation, feeling if there's any pain. Then a range of motion. We'll do other kind of things. Get your height, weight, blood pressure. Those are vital signs. And then that's it. So subjective is what you told us. Objective is what we found out by doing the physical exam. The assessment is what we think it may be. So we could say back pain due to meningitis. Just say that's in the assessment. 21-year-old man with assessment of, I'm just saying that. So, and then the plan is, I plan to give as a physician ibuprofen, 200 milligrams twice every 6 hours for 3 days, and I will reassess in 4 days. That's basically how we will do a SOAP note. So it may be related to your. I'm not sure again like what you're saying, touching, but I hope I tried to answer your question as best I could. It's a little bit difficult with just a word prompt. this would literally be part of the chief complaint. When we write our notes, we chief complaint of in the last 2 months I have back pain, or I have pain in my lumbar region, and then like I said, we keep going from there. So it may be related, but yeah, things like this make it interesting. If you guys have questions, I'm happy to answer them, and hope I can answer them the best I can. But if you have family members that are looking to speak to a physician, and I'm a general practice. So I graduated medical school in 2009. I've been now practicing for about 11 years. And I right now live in San Jose. I practice out of San Jose, California. I am a general practitioner, meaning I see basically whatever, I see people coming in for whatever reason brings them to my office, and then if need be, I do referrals out to other providers. But yeah, I do this talk every day from 12:30 to 1 o'clock. Today was sort of an exception. If you have any questions, feel free to ask them. You can leave a comment, or you can direct message me on YouTube. And my name is Dr. Abdullah, and thank you again for your time, and I'll see you tomorrow. Oh, and I do this weekdays. Thank you. Bye-bye.